Hello, my name is Randy Odebrowski, Chief Operating Officer for Good Days. Our programs ensure that underinsured people who have chronic and rare conditions can maintain access to the treatments and services they need to live their lives. This includes preserving their health and quality of life, as well as protecting their financial future. Thanks to the generous support of our donors, we protect the lives of hundreds of thousands of individuals every year. Nonprofit charitable assistance is a critical safety net for many patients and their families, particularly those living with rare, chronic, complex, or life-threatening conditions. Once an individual is diagnosed with a condition and is prescribed a treatment, they, their caregivers, family members, specialty pharmacy personnel, or a patient's doctor can then reach out to Good Days to apply for assistance for related and available grant programs. Our in-house team of care navigators and online enrollment platform help to ensure fast and accurate processing. In addition to the charitable assistance we provide, Good Days is expanding its reach and impact as an advocate for the chronic and rare disease community each and every day. This year, more than 30 governors across the country joined us to proclaim July 10th as Chronic Disease Day. We were honored to bring together a coalition of dozens of leading patient advocacy groups, including the American Heart Association and the National Breast Cancer Foundation, to help raise awareness about the rising rates of preventable illness and the need for access to care for all conditions. We were especially honored to host leaders of the National Institutes of Health and the CDC, who joined us for free virtual educational seminars that are still available to view at www.chronicdiseaseday.org. Throughout the year, we also meet with members of Congress and convene advocacy summits with patients and patient group leaders to educate lawmakers on challenges with access to care. Please contact us to learn about how we can partner together to help more people get the care they need. I'd also invite you to stay tuned to learn more about Good Days, including hearing from our pharmacist partner, as well as a patient perspective on the lives that we all touch and the issues and access to care that we all deal with. Thank you very much. I appreciate you taking the time to meet.
Hi, Randy. Thanks so much for having me. Super excited to be on here with you today.
So all we want to do is just kind of, explain to the attendees here at the Healthcare Advocate Summit, both virtual and in person, kind of what Good Days is about and what we do. And, you're a key part of us touching people across the country, not only professionally as a pharmacist and a key member of the Walgreens team, but also as a board member for Good Days. So you kind of see it from the full spectrum. So with that said, Nhat, can you tell us a little bit about your current role with Walgreens and your career in healthcare?
Yeah, absolutely. So, I am a pharmacist by trade, and I'm really proud of that fact. With Walgreens, I actually employed through Walgreens, and they align with my values. Throughout my time in the profession, I have been able to witness firsthand the changes in the profession of pharmacy. There's been a really big evolution and also transformation from a dispensing model to really a more clinical model, and that's what drives my passion. Currently, with the Walgreens organization, I help support about over 100 retail and specialty pharmacies in the Dallas area. And that's through really leading patient care initiatives, along with being able to help support operational excellence and also identifying a lot of the efficiency gaps and maybe also trying to find solutions to those issues. At the end of the day, though, my primary role is to be able to deliver on that customer experience, improve outcomes in order to keep our communities healthy.
I think you summed it up very well. I think the role of the pharmacist has changed. I was in pharmacy with Walgreens for 20 plus years myself, and just the expansion of responsibility. But more importantly, I think that frontline care, that face-to-face care just continues to expand, and just appreciate all you do and all your fellow pharmacists across the country do in helping patients get access to care that they need and the true clinical support. So, Nhat, how do you think patient assistance foundations such as Good Days help pharmacists to better support patients?
Yeah, so as community pharmacists or pharmacies, a lot of the times we have patients come to us who have been newly diagnosed with disease states such as cancer, HIV/AIDS, hepatitis, multiple sclerosis, along with transplant. And a lot of the times, these patients come to us who have been newly diagnosed and do not know what to do after that initial diagnosis. You and I both know that there is a cost, some pretty heavy costs associated with these disease states. And that's where patient assistance foundations such as Good Days come in and help support the patient. Not only do they help with financial burdens, but then also they help provide really that linkage to care. I can think of a really great example, and I can really be able to tell you what Good Days does, but it actually really hit home for us earlier this past year. So, in December, I was actually trying to come up with a plan to help protect our most vulnerable patients at the long-term care facilities, and had a new grad in my area who had just graduated from pharmacy school, who was helping me out on this project. During the week of Christmas, unfortunately, she became ill. And Christmas Eve, she actually reached out to me. Wasn't able to touch base with her until Christmas Day. And when we were finally able to, speak, she told me that she went to the emergency room Christmas Eve and unfortunately was diagnosed with leukemia. Well, you can see that's a terrible diagnosis, but to receive this information on Christmas Eve, but then in addition to that, unfortunately, she was in a predicament where she had just graduated from pharmacy school in about $200,000 of debt. And the last thing that we want her to have is that financial stress that is associated with having leukemia, right? And so that's where we were able to connect her with Good Days. And Good Days was able to help her navigate such a complicated system, not only navigate it, but then also guide her to some other organizations along with resources that are dedicated for that particular disease state.
Wow. Well, thank you for sharing that story. I think you said it earlier best, though. I think it's the linkage of care. And I think that's where, our partnership in the healthcare space, whether it be Good Days or other foundations, yourself as a pharmacist through Walgreens, any providers, I think it's important we all, do what we need to do to continue to help patients and people gain access to care. And, patients sometimes struggle. So it's often their loved ones, their caregivers, other folks who may be part of their lives that get involved. And the ability to kind of, again, create that linkage and kind of help navigate that access to care is so very important.
Yeah, absolutely.
So now, what are some other opportunities that you see that pharmacists have to connect patients with different access to care resources?
Yeah. And so, whenever I think about community pharmacies, or actually pharmacists, because again, I'm a pharmacist by trade, Randy, I always think about us as being patient advocates, right? We are uniquely positioned in the community to work collaboratively with other healthcare providers and other payers in order to provide our patients with that high quality care. I think one of the surprising things that I found out whenever am working with my specialty locations is the fact that over 80% of those specialty scripts that our chronic patients have, they are actually adjudicated, or they're we process them through our traditional retail setting. And so we have a great opportunity, in that space to be able to take care of our patients. A lot of the times, as you and I both know, those specialty scripts are known for, being expensive, along with being a lot more complex. And a lot of times it requires a little bit more time, and also the expertise of not only physicians, but insurance companies. It requires the expertise of, pharmaceutical companies, and also pharmacists to be able to process those prior authorizations, process financial assistance, along with counsel, and educate our patients. So that's where I personally see the value of the pharmacist, the role of the pharmacist in being able to increase awareness, but then also to provide, access to those life-saving drugs. And in doing that, that's where organizations such as Good Days come in order to be able to provide that assistance.
Definitely. I mean, that collaboration is essential. Number one, because there isn't a one-stop shop for resources from a financial perspective, from different levels of support that patients or their circle may need. So the collaboration of working together and trying to understand what that person needs, whether it's a patient or again a support member for them, and leading them to hopefully a solution. Because I think again, unfortunately, demand far exceeds the supply of resources that are out there. So wherever we can collaborate together, and again, create that linkage to care that we spoke about earlier, I think that's extremely important in the roles that we play.
Yeah, absolutely. And whenever we say it takes a village, it really does in terms of advocacy, not only from providers, but also from patient assistance foundations and also your community pharmacists all too.
Couldn't agree more. Well, Nhat, thank you so much again for taking the time to talk with us today and share your experiences and your stories. And just again, more importantly, thank you for continuing to make a difference for people across the country and help out and be an advocate and champion where we all need to be.
Thank you, Randy. Appreciate it.
Take care.
You too.
So Jamie, what happens when an individual reaches out to Good Days?
Sure. Well, typically they're reaching out to get some type of assistance, and we have multiple ways for that patient or that visitor to gain access to that. So our online application is very simple. It's about maybe 5-6 minutes, and they should find out if they're approved for copay assistance or approved for that particular program that we offer. Obviously, now we have multiple ways that they can try to get enrolled, and that's traditional ways from mailing to faxing to now recently they can actually start texting us, which we're really proud of. So we have many ways for the visitor to try to get some kind of access to treatment.
Okay. Awesome. So what are some of the programs that Good Days offers?
Well, that's probably one of my favorite things to talk about because we have so many different ways for patients to either get treatment or maybe even it's the access, meaning the travel programs that we have, or maybe they're having trouble with their insurance. So we have a specific program where we can take care of the premium part of their insurance, all the way down to diagnostics. So we have a trained team that can help them get their appointments scheduled up for their diagnostic testing. Also, recently of 2020, we rolled out an emergency relief program, which we're really excited about. So we look to the future to kind of utilize that in many ways. Obviously, one of our biggest programs is our copay program. Typically, that's where if we have an available program that's open for that disease, then we can try to reduce their copay so they can have maybe a smoother way to get their medication, access to that medication.
So what does it mean to have actual care navigators that can connect with and speak to individuals who reach out to Good Days and need that support?
Sure. One of the things I think separates us from many of the other programs out there is that they're more of an advocate than anything. And so it gives that patient a compass or a lighthouse during that storm of trying to figure out how in the heck am I going to get to my doctor's appointment, or how am I going to get this medication delivered to me, or there's a natural disaster and now I need my medication, but there's a holdup at the pharmacy. Well, these guys say they have the tools in their toolbox to go to bat for a patient and make sure that they do have that access to the treatment, or they can get that medication delivered on time. So that's one of the things that I think these care navigators take pride in themselves is if there's an issue with that patient having some kind of treatment or need that access to medication, that they're going to troubleshoot that problem and find a resolution to it. Even if it takes multiple calls or multiple days, they're going to make sure that they resolve any problems with our patients.
Thanks, Jamie, for taking time to answer those questions today. I hope everyone has a great day at the Healthcare Advocate Summit.